Hello everyone, my name is Khalid Al-Mijari, and today I'm going to talk about Hospital Price Transparency Rule as my current event number 2 for MHA 575 class. I choose this topic because I believe this rule will have a great impact in healthcare now and in the future. The goal of the price transparency rule in the healthcare is to give people the chance to know how much they are going to pay for the healthcare services before they decide to receive it, and to make value-based decisions. According to the Centers for Medicare and Medicaid Services, hospitals are required to provide fair prices for all offered services starting from January 1st, 2021, by posting their standard pricing information online. A second set of rules that requires most private health plans, including group health plans and individual health insurance market plans, to be more transparent, will go into effect uh, in 2023. There are some challenges in implementing cost transparency. The most obvious challenge is is uh, is is a lot of patients don't fully understand how health plans work and don't have medical background or training to correctly understand the information provided by the new rule, and to make the right decision in selecting the needed products and services. So, where do we start? Let us start with the basics. Although the goal of requiring hospitals to post prices online in a machine-readable format was to give patients the chance to compare and choose provider or services was not very helpful. This is because hospitals use billing keywords or medical terms that will not make a sense to most of people who doesn't have a medical background. An example of this is seeing in this University of California, San Francisco Medical Center price list. As we can see, a single procedure has multiple options to choose from wherein you will know which one applies to you. If you are not a physician or if you are not familiar with this procedure. In addition to that, hospitals use different names for the same procedure that makes that makes that makes it more difficult for patients to compare prices between hospitals. As with every new rule or law, there will be some changes. So now we are going to discuss what are the expected changes and effects of the price transparency rule in healthcare. First, the prices will become more competitive for some healthcare services. Hospitals may decrease the cost of services such as imaging and laboratory as well as outpatient clinic visits. Conversely, other hospitals may increase the cost of these services. Study shows disagreeing information on how price transparency affects the healthcare market. Some showed that there is no correlation between price transparency and decreased spending on healthcare. On the other hand, some studies showed evidence of increased savings when the prices are transparent and available to the consumers. Moreover, large healthcare organizations or hospitals with the high reputation may discover that some hospitals are paid more than them. Despite the gap in the quality of services they provide. For example, Hospital A in Chicago is nationally known as pioneer and standard for procedure X, and they are charging $20,000 for it. Now, do the price transparency rule of 2021, Hospital A found out that Hospital B in New York is offering the same procedure for $30,000 without the hospital being known as a center for care, center for quality for that service. It's highly likely that Hospital A will also increase their price in the basis of patient will be paying more for the best quality of service. Second, hospitals with the viewer networks or community hospital will be pushed to merge with larger networks to maintain operation. Merging leads to higher pricing, but doesn't mean an increase in the hospital's quality of care or services. The graph shows that since 1999, there has already been an increase of community health merging with the health systems and expected to continuously increase with the price transparency in effect, driving hospital prices even higher. Another expected outcome of the price transparency rule is a result of the previous one. Not all hospitals will be able to partner with large networks even if they choose to. For example, hospitals in rural areas or safety net hospitals operating at low margins may not be practical merge for the large networks. Hospital in rural areas or safety net hospitals that were unable to merge with large networks will struggle to continue with operations and will eventually have to close. This graph shows the increased number of rural hospitals that has closed between 2008 to 2017. And the price transparency rule may further increase this number. Another graph here, increased closure of rural hospitals or safety net hospital will have damaging effects on the community and healthcare. As we can see in this graph 2017 map, struggling rural hospitals are mostly in the South and Midwest states. This greatly affects the accessibility and delivery of healthcare for the affected community. The next projected impact of the price transparency rule is there will be slow adoption of new or state-of-the-art technology. This is mainly because the healthcare administrator will be very thorough in reviewing the cost and revenue of the adopting new technologies and how will the price of their service fare to other hospitals after implementing it. An example is a hospital to upgrade their laboratory equipment, but upgrading will result to price increase in laboratory tests. In addition to the thorough review of cost and revenue, healthcare administrator will have to decide on how to implement the new equipment while maintaining a competitive market price for the laboratory tests. And these processes will take time. Technology and healthcare go hand in hand, and technology plays a big role in the improvement of healthcare, and the delays in adopting new technology may impact the quality of healthcare. With the price transparency rule, the benefit design and reimbursement model will likely change. For example, insurance plan will have to adjust their benefit design and reimbursement models to deal with the effects of the price transparency in healthcare. One system is a value-based benefit design. This design focuses on the cost effectiveness of disease management, wellness, and disease prevention program, rather than the overall cost reduction of healthcare. The price transparency rule can create confusion in progressing the new value-based payment model. Another expected outcome is an increased number of blocked mergers. The Department of Justice and Federal Trade Commission has been effectively working together to block mergers for antitrust reasons. Mergers benefits the consumers by being able to deliver service more efficiently. But some mergers change the healthcare market dynamics so much that it hurts the competition in the healthcare market. If there is not a healthy competition in the healthcare market, price increase and low quality of service may be apparent. An example is the 2015 $54 billion move of Anthem and Cigna to merge. Anthem and Cigna are both considered to be on the top list of healthcare insurance companies. Their merging would cause a massive change in the dynamics of the healthcare market. The merge was blocked by the Department of Justice on the grounds of hurting the competition. As seen in this 2019 report from the Federal Trade Commission, the largest percentage of antitrust enforcements was in healthcare, pharma, and medical device industry, with 28% and 18%, with a general healthcare industry. With the transparency rule, the Department of Justice and Federal Trade Commission will be able to fully analyze the effects of the potential healthcare organization or network merging, resulting to an increase of blocked mergers. Lastly, the price transparency rule will not affect most consumers who are isolated from the financial responsibility of healthcare. For example, many Medicare and Medicaid beneficiaries are subject to minimal financial obligation, or sometimes none. Others have insurance plans that have fixed cost for sharing, only consumer only consumer covered by high deductible deductible plans may be affected by the rule. Medicare and privately insured individuals with low out-of-pocket uh, obligations will most likely not be impacted by the price transparency rule. We may or may not see these changes once the price transparency rule will be on full effect. But this rule may be necessary to reform the healthcare system in the United States, especially during the pandemic, and this will come with some challenges. As I mentioned in the beginning of this presentation, I believe there are many people who does not know the real cost of the healthcare even after receiving the explanation of benefits months after the procedure or stay. It's fair to say that along with the price transparency rule, we should do our part and educate ourselves on how the healthcare system works. Prices are affected by many factors. One is location. For example, a procedure in hospital A is $100, but just a few miles away from hospital A, the same procedure in hospital A may cost $800. Before the price transparency rule, it's almost impossible to know how much will a procedure cost, and that's because no one really knows. The price transparency rule can help patients to know the differences in prices and and the and in the long run can help patients to save money. Patients should consider to be more proactive in utilizing the tools and information that are that the price transparency rule provides. It's said that millions of Americans are in debt due to medical bills. Some people had to sell their house to be able to avoid a needed procedure or to pay off a medical debt. Other residents of developed countries don't face the same extent of financial burden when it comes to health care. When it comes to healthcare, because their healthcare is either universal, state-funded, or a national health system. Although price transparency will not solve this problem, having the option to know how much will it cost you before receiving the service will surely help consumer to plan and make backup plans to avoid medical debts. I eager to see to see what the price transparency rule will bring. What if every time we Google X-ray, Google give us the nearest X-ray center, price of X-ray in each location, ratings, reviews, and suggest options? Will this bring the cost of healthcare down, or will it increase it? Will the competition in healthcare markets increase the quality of services or decrease it? Will the price transparency rule delay the innovation of technology in healthcare? To what extent will the price transparency rule change the healthcare insurance models? The price transparency rule is still new, and we have a long way to go to see what it will bring us. This is the end of my presentation. I hope you enjoyed and thank you for listening. These are my references, and if you have any question, please leave it in the discussion and I would be happy to answer it. Thank you.